If y'all are ready, we'll get this show on the road. You good? I'll read the emergency evacuation. In the event an emergency evacuation alarm will sound, everyone should exit the building by way of the nearest stairwell in a safe and effective manner. If the nearest stairwell is blocked by smoke, please use the other stairwell. Do not use the elevators. Once you've reached the main floor, follow the exit signs to exit the building and quickly proceed away from the building. Please be mindful of others evacuating and also of emergency vehicles. Thank you very much. I'd like to welcome you to tonight's meeting of the HR and Insurance Committee. In essence, we have one main thing on the agenda. Two, if you look at the way the agenda's set out, but it all boils down to one. Madam Clerk has taken the roll, so we're in good shape on that. I'll ask for any comments on items on the agenda if anyone sitting in the audience would like to address anything on the agenda. Seeing no hands, nothing to be addressed, I'll deal with items not on the agenda at the end of the meeting. We'll swap number 2 down to below number 5 and ask for a motion to approve the minutes of October the 30th, 2012. Ms. Crisp, do I have a second? Mr. Dunlap? All those in favor, please signify by saying aye. Aye. Opposed, say nay. Being that, we'll move on to item number 4, which is discussion regarding the employee clinic. In the previous meeting, I think Mr. French brought up and there was a motion made, and however, we do not have Mr. Mann here tonight. And
I just spoke with Mr. Mann.
okay, hold 1 second and let me turn you on.
All right. Drew was unable to make it here. Did I just mess that up?
Yeah, but keep talking.
Drew was unable to make it here tonight. I just got off the phone with him. Y'all had asked us to run some numbers to see some options on what it would cost if we were to go another route with a different type of clinic. Drew ran some numbers. He contacted some of the vendors that he's used with other clients. Pretty much the vendor he said he would recommend would charge a $100,000 setup fee. That's $100,000 to actually get the equipment in and get the clinic going. And it would be an average of about $16.50 per employee charge. Right now we're paying $6 per employee charge. So you can see the value we're getting right now. I also talked to Care Here. They are there's a local company that they're representing that's wanting to set up their own clinic here, off-site clinic. They wanted to go in with the municipality. That their offer was pretty much they would pay the setup fee, but we would probably, in speaking to the representative, it looks like we would be at about $18 to $20 per employee with them. So that's a significant increase in what we have at this time.
Please, if you will, hit your button. If you'll hit your button, it'll turn your mic on.
Making noises. In terms of this setup, that means that we would supply the place for this to happen also, right? It's not like they have as opposed to what we have now currently with East Tennessee Medical that's already in place. And they would charge us $100,000 to set up a place that we would provide for them.
Exactly. We'd be responsible for rent, heat and air, cleaning, all that sort of stuff.
Okay, so that's sort of a hidden cost that's added to that also. Thank
Yes.
you.
The equipment's in that clinic. Is that East Tennessee Medical
Yes.
Equipment and everything?
Yes.
I was thinking we furnished everything. No.
No. That was part of the deal. That was one reason we've got such a good deal is we're using their existing clinic. We're just feeding our employees into an existing clinic. So we don't have as much staff cost, and that's the $1,650. We have our own. We're paying. We're gonna have to hire our own staff.
I guess I'm confused because at the last meeting, I thought Drew had said that he had several places out there that would probably save us money.
No, sir, he did not
He
say
did not
that.
say that.
No, sir.
That's not what I understood, but okay.
No, he actually, what he said was he had several places where he could get recommendations or quotes. That got you, folks? All right, in line with this, what was previously presented was the request to forward on to the full commission. Mr. Heineman had furnished from Blount Memorial an agreement to extend through the end of June 30th, 2013, which would in essence complete our physical year, an agreement that would, everything would remain the same. That's what brought all of this conversation about in that meeting. So in line with that, if there's no other questions, I will stand for a motion okay, I'm sorry, go ahead, Mr.
Yes, sir.
Blount.
And at what would be the prorated cost for a half a year? Would it be half what?
It won't be a prorated cost. We'll continue at the.
No, I was gonna turn that off. You can go ahead, your answer. It'd just be continued per employee cost. We pay $6 per employee per month for use of their clinic. Three for children.
I was under the impression we were paying approximately $300,000 right now, a flat rate or that was just, no? Okay, so it's based on the $6 per month per employee.
Right, and three, Joey's point out, 3 for children.
Okay.
Children are covered.
That's, and they would continue that until June, correct? And that, in light of that, I would make the motion that we forward that recommendation on to the full commission.
Do I have a second? Okay. Any other questions, comments, discussions?
Yeah, if I can I ask Mr. Heineman a question?
Yes, sir, you can. And to be honest with you, if you want to, Mr. Heineman, if you want to come up and introduce yourself, because you're next on the agenda anyway, and we'll just give you your spot there in the limelight.
You ready?
I'm ready.
Okay. Don, one of the issues that we've had over the last few months is some of the employees have really had an extended wait when they come in there. It's been some 2 and 3 hours, and I know it seems a lot longer when you're sitting there, but some of them are confirmed that they've had to wait quite a while for really basic things like a cold or something like that. Is that something that y'all are going to address? Is there something we can do to ensure that they're not having to sit there for 3, 4, 5 hours on some of these issues? Is the wait going to be, is there something that was causing that? Is there something that you've done to fix that, or what exactly was the reason for that?
As you know, first of all, I'm Don Heineman. I'm the CEO of the hospital. This is Will Pitts, our director of our physician services. He's over all of the hospital practices, so all the doctors' offices, I guess everything rolls downhill to him. I brought him in case we had specific questions that you might have about the practice. Let me just give you an overview. The hospital closed on the purchase of ETMG on October 1. On the same day, something that they had been working on implementation plans for about 1.5 years was on October 1, they went live with a new computer system. Didn't have anything to do, it just happened to coincide with the day we were turning the key and purchasing that we closed on the practice. A lot of people felt like some of those delays was all the hospitals bought it, everything's slow now, taking longer. The majority of the wait was they put in a new computer system, and every patient that came in the door had to be re-registered and re-entered into the system. That was the biggest delay, and we had kind of a nightmare there. The first week, we had a little bit lesser of a nightmare the next week. We're still having some delays, but we've been changing a few things. We've added a few staff up front. It's really been a log jam at the front because every single patient had to come in and fill out about 7 forms, and then they had to enter them into the system because the old computer system would not port all of that information over to the new one. I think we've gotten lots of black eyes over it. There's a lot of people just felt like because the hospital bought it, now it's all screwed up, and we have a lot of waits. And I'm sure we contributed something to it. But the majority of the problems that all of y'all, if y'all have heard employees complain about the waits and the delays, they've almost all been surrounded. That new system they put in, they're trying to get everybody entered. Most of the people, when they go back for a second or third visit, don't have 7 forms to fill out now. If they're just seeing their doctor, they won't have to. They just walk up and register like they always did. If they're going for an x-ray or a lab test, they'll have to just fill out the form for that particular piece, but not for the whole thing like they did. That first few weeks was just, there wasn't anything we could do about it. We added extra staff, set up extra tables out front. We tried to accommodate it, but it just completely backed up on us and kind of overwhelmed us. So that was the biggest problem that happened. It's been getting a little better each week. It's still not where we want it. I had a complaint today about it, about somebody having to wait too long for it. But the numbers, we've redistributed the work. We've added a few employees. We've tried to eliminate a few of the forms to fill out. But that was the biggest reason for that those complaints you've been hearing the last month and a half have been all around that.
Just a question, and this may not be something you can answer right now. Would it, if we were to distribute those forms amongst the employees with the understanding if they'll go ahead and fill those out, it will expedite when they do go to the clinic, and we went ahead and had those forms filled out and you had those entered, would that make it any easier so that when they're going in with their kids sick and probably stressed as much as they're going to be, as you know, when your kid's sick, if y'all already had that information, would that make things work any smoother for you all, do you think?
That's why I brought him.
Okay.
Yeah, I think any way we could partner, to speed it up would be welcome. So I think we could definitely partner with you guys to get you
Okay.
the forms that are needed to be completed, and so you could distribute them to your employees.
Good idea.
Well,
That would sure be helpful for I think, don't you?
well, years ago, at the original clinic, that is exactly what we did. Blount Memorial employees were manning it, and we did actually send those out and have them filled out in advance. I guess it's sort of up to you guys. If you would like for us to do that, I'm sure Jody'd be happy to send them out.
Well, another option we're looking at is having those available electronically, so your employees can go to the website and complete those, or print them and complete those. So that's another option that we're looking at regardless, just not in addition to you guys, we look at that for all patients. So, but we could expedite that with you guys.
Right, if you forward it, what you're talking about, Mayor, is forward it to Ms. King. She could forward it to the Blount County employees. Those intending to use could fill it out online.
Wouldn't be able to online, they'd have to print
We
it
could
out and
start
bring it into
initially,
you.
and then,
Okay.
that's what we're working with our IT staff on, is to have those where patients.
Also be a good way to advertise
Well, versus us having to send out mailers.
Yeah.
It could actually be,
I can email everybody in the county.
Right.
Okay.
Now, does every member, not employee, but every member in that household that would be seen at that clinic need to fill one out separately?
If they're seen as, I would say yes, yes.
Now, do you want those on everybody or just those who are coming to the clinic? Fill them out before they come to the clinic. How logistically do you want to get the forms? If we send them out to our employees, do you want us to tell our employees, if you're going to the clinic, you need to fill out this paperwork?
If they come in, they would just present it.
Well, I think if you present it to them that this will speed up the whole process there, and if you plan on attending that or using the clinic, if you'll go ahead and fill this out, this can really expedite your getting in to see a doctor, and the entire process could be sped up. I don't know how much it would speed it up. Evidently, filling out forms does take a lot of time, I know. But
I think they're having to stand in line to get the forms, then they go sit down for 10 minutes and fill it out, and then they gotta go stand back in line to get them. So if they were to just show up with them, it's gonna skip a step. The other thing that happened with the old computer system, they were able to print out the night before all the doctor's schedules in ETMG. So when the Care Today clinic got backed up, they could pull their schedule out and see that, oh, Dr. Milholland's got an opening at 2 o'clock, and send a patient up to see him, and it would help the backlog. With the new computer system, the first 3 or 4 weeks, that wasn't working. They were just trying to get it set up and going and all that, but they've implemented that now. So it's starting to take some of the backlog. They're now able to, when we get too backed up, they can route some of those patients to an empty doctor's appointment and get them seen now instead of having to wait as long. So those two things are really helping. But your idea about filling the forms out ahead of time, I think, would probably knock 10, 15 minutes off the front end for those folks.
Okay. Thank you, Don.
Mr. Dunlap?
Thank you, Mr. Chairman. That's been mine, Don. It's just been the complaint on the delay and the wait. Once the forms are filled out and they're handed to them, that's taken 15 minutes off, and then the people that I've got here that's come and fussed at me on account of the wait over there has been 2.5 to 3 hours. You know, there's another, if you knock 15 minutes off, then why are we still having to sit there for another 2.5 hours to see a nurse practitioner or a doctor for a cold? One of my guys went on the 18th of this month, sat over our 2 hours. Son was sick, he left. Went to a clinic over here on Gill Street and was in and out within 30 minutes. You know, this don't make sense to the employees, and then we've encouraged, since this thing has come about, we have really encouraged the employees to use these clinics because it saves the hand out of our insurance. So that part is one delay knocked off, and this is our part doing that. What are you all can do to expedite a little further then to make that 2.5 hours, you know, maybe no more than an hour? Because we, you know, before, and I'll use me as an example, 30 minutes is the most I've ever sat over there. Mm-hmm. Seeing, sitting there, signing up, seeing, going back in, and leaving has been 30 minutes. So what can you guys do to expedite these people getting out of there?
I think that's certainly our goal. We can't always control the workload. I know we got backed up with, like I said, in the last month and a half, we were back. What happened was a backlog on the front end. So people were stacked in the waiting room, and it was delayed getting back, and it ended up, when they started coming back, we had this big group coming in at one time, and they weren't trickling through like they would normally. I can't speak to the specific complaints you've had about the individuals that might have had to wait 3 hours.
Each one of them has given me war stories of sitting there.
Right.
Now, one of them stuck a screwdriver through his hand. Took him 3 hours to get in there and get out. You know, that's almost as bad as a cold, I think. Sitting there, your hand swelled up, and bleeding a little bit. So, you know, it's the stories that they're telling me that I'm glad you're here to try, you know, to relieve these problems to where these guys can, ladies and gentlemen, can get in there in a reasonable amount of time and see a doctor and then get out. So if we can be one like we was before, you know, it's going to tickle everybody to death.
I can speak to a couple other things.
Yeah.
We've moved one of the physicians that was in the Care Today area to another location of the room.
Would you mind speaking into the mic?
It's recorded.
Okay.
Everything in here is recorded in this room, and with you speaking over there, that camera at the back sees you standing there with your mouth moving, but it doesn't hear you.
Okay.
Thank you.
Okay. I'll give you a couple other ways we're addressing the issue and a couple other reasons for the delays. A couple of things we've done. One is we've moved a physician that was in the Care Today area upstairs to where the specialists are. He was a specialist, so we've freed up about 3 patient rooms in the Care Today area. So we've increased capacity there. We've added 3 registration positions to the staff, 1 in the primary care area and 2 in the ancillary registration area. And we're in the process of dropping an additional 2 computer lines to another area that's adjacent to the dispensary. So we'll be able to handle additional volume there. one of the things that's happened is with the new computer system, the physicians, their schedule was lightened by about 50%, 75%, just in the regular scheduled clinic. And so what Mr. Heineman was referring to as far as us being able to send overflow patients over to the primary care area from Care Today, we weren't able to do that. And now that they're at 100%, they've had some backlog from that 50% reduction and 75% reduction, and so they haven't been able to work in as many patients. So now we're working through that now. Now we've got incidents of flu and colds, and you've had increased volumes, which have kind of compounded the issue. But we've also had an engineer come in that's to look at workflows, to try to improve that. And so, believe me, we're working. It's in all of our best interest for it to go well, and it will go well. So it's just we're going to have a little bit of time to work through some of these current issues.
We understand that. We understand that the transition is a major item that you're dealing with, but you don't listen to the sick people.
Yeah.
You don't listen to employees, so.
Yeah.
So whatever you can do, we greatly appreciate it, gentlemen.
Mr. Lael?
Thank you, Mr. Chairman. Couple points here. One, if our guys don't make it a point to use the clinic, then it becomes non-feasible for us to work in an operation like that. Our whole success rate is based on participation. I mean, that's something we've worked, Bill alluded to it and some other people, and the mayor's question had to do with that. When they're disgruntled and don't go, then they go to other places that cost us as an insurance much more money. So our whole point is to rebuild that. The idea of the pre-registration is a good idea, not only to expedite, but to advertise that the clinic is up and running and doing what it does. One of the things I heard Mr. Heineman say earlier was that they pre-scheduled all of the doctors at the East Tennessee Medical or something. Is that a practice? For example, if I were working there as a doctor, if I walked in, I would have my schedule lined up with no gaps in it for the day or whatever, or do you all make allowances for walk-in? What did you call your care clinic? Care Today clinic. No predetermined appointments, obviously, when you got situations in a clinic. Is there a way to kind of spread their schedule? Is that where you all are headed, so that they can put people into the gaps to alleviate the long waits?
Yeah, the Care Today clinic is staffed with physicians and nurse practitioners.
Right.
And they may see 100 people today, they may see 150, they may see 75. Most of the doctor's offices over there have a pretty full schedule, but
Right.
Occasionally somebody's going to cancel for the next day. There might be an opening or something. They would print the schedule out for all those doctors the night before and give it to the doctor in the Care Today clinic. So if they were getting backed up, they could see, there's an opening up in one of the doctor's offices. Send the patient up there.
Oh, okay, I got it.
And get them through faster.
Yeah, I understand your
they were-
scheduling a little better.
They were
now.
trying to
Thanks,
use
yeah.
those openings to help the backlog whenever they got backed up. The problem was with the new computer system, that first few weeks, they weren't able to print out the schedule. So not only were they working half level trying to get the new system put in, the Care Today clinic didn't have the doctor's schedules to know where they could offload. So it was a real
Yeah.
bottleneck.
Right, and then another issue that was brought to me in terms of this was that some of the folks had gone over there, the people, and they didn't say exactly where. It may have been the reception desk, whatever. They were like, okay, we just been taken over by the hospital. We don't know what the protocol is now. And apparently that went along with this, disconnect with the system and the new whatever, and that's also one of your priorities now, because those are the kinds of things we need to be passing on to our employees and the people that use it to alleviate their concerns about the long wait. Because if we can continue this process, then it becomes beneficial both for the employee and the insurance to maintain. So those are the kinds of messages we need to be passing to our people. So, but thank you.
And I want to make sure everybody understands. I know exactly how you feel. The hospital is self-insured. We have a little clinic up at the hospital that we try to encourage our employees to go to, and they have minor things because it saves us money if they go to a doctor and see an office. So I know exactly what you mean. You want them to use this because it's gonna save an office visit.
Otherwise, we're no better.
Right.
You take our overflow? When ours gets back to.
Well, you know, we've bounced around lots of ideas. You know, we have the little clinic at Walmart too that we run, and we've got a clinic up at the hospital with nurse practitioners in them, same qualified people. And we've talked about trying to do a better job of coordinating all of them. And if somebody shows up and there looks like there's going to be a 2-hour wait, to be able to pull up the schedule and say you can get in 5 minutes over here or somewhere else, and maybe. So we've talked about that. We're not there yet, but at the end of the day, we want to be able to.
I'm glad to hear you say that. So.
Ms. Chris?
On a positive note, over the weekend, there was a Blount County employee that something blew in her eye, and so she went to the clinic, and of course it was going to be at least a 2 to 3 hour wait, and of course, you know, the eye was just really bad, and so the worker said, just a minute, you know, she said, let me check and see if I can get somebody to see you. She said, I know how that must hurt. So they went ahead and let her go back, and so that's a plus because she could have been sitting there 2 to 3 hours. But my complaints, just like theirs, is the people that's had to wait 2 to 3 hours. They get back there, and it takes all of 3 to 5 minutes for the doctor or the nurse practitioner to come in, and they're like, we waited here for 2 to 3 hours for maybe 5 minutes.
Right.
So, you know, it's hard for them to understand. It's hard for me to understand what takes so much time in between. Right. You know, if you're only spending that much time with the patient, then why? And then another complaint was they're going to the clinic and they're not really getting results and having to go on to their medical doctor. So they've, you know, they're not really feeling like they're being treated for what they need to be treated for. It's just kind of a brush off type thing. So.
You want to address any of those?
Yeah, I think if you have a staff person that has an issue that is willing to let us know specifics about the incident, that would help us address if you've got an employee that we can kind of drill down on and find out what happened with their visit, if they were unhappy.
Okay, I did at one meeting, and I guess it was before Blount Memorial took over, and Ron German was supposed to have gotten back with me. I got him some detailed information on a couple of employees, and of course he never got back with me. And then Jody had to talk to him, and she asked if he ever got back, and he said no, but I looked into it, and you know, it was an hour wait or whatever. So there's kind of a problem there too, and I'm not throwing him under the bus, but he wasn't very helpful trying to work anything out with us. So
I'll leave you his card.
Yeah. And he'll, yeah. Okay. I will. I'll get you my information.
Oh, that does make it for an interesting question. If there are situations, are you going to be our contact person in terms of issues such as these, or Or should we,
Yeah,
I know Don has.
I'd like Will to be the contact person, and he can follow up on it. And,
Okay, and that helps to have a, that
Right.
channel open there.
And
Thanks.
Ron Germans is still at ETMG, but the hospital also owns other practices that we have managers at different sites, and all of those managers report to Will. So he has the big picture and can follow up on things and get back with you, and then he reports to me. So if you don't like it, I'll throw him under the bus.
Will, those two thumps you heard were the bus back wheels going up?
No, I tell everybody about the hospital. I love my job and I love the hospital and this community, but the unique thing about running a hospital is most of our patients, our customers, don't want to be there. If you run any other business, if you run a restaurant or the grocery store or anything, people are coming there because they want to get groceries or they want to eat out. Most people walking the halls of Blount Memorial don't want to be there. It's the worst day of the week or the year or whatever. And so I understand that, and I have to be a patient sometimes. I can't stand to wait. That's not what we want. Won't be able to get the folks in and out. I can't answer specific incidents. If the person went to the clinic and Dr. Ron worked them up and he felt like they needed to go on to their specialist, it was beyond what he needed to do there in the clinic. I'm not a doctor. Probably not going to question his medical judgment about that, but we certainly, if we knew specifics, we could look at the specifics of any complaints any of you have, and we'll get back with you on it, let you know what we find.
Mr. Dunlap?
I guess as a committee and as an employer and office holder, I need to hear from y'all that the problems are being addressed. The problems will make it easier for the employees as they go to the clinic after this night's meeting. I can relay that on to my employees.
Yeah, it's been a top priority for us. I've seen it the first day over there. We went over and welcomed the ETMG employees. They're becoming Blount Memorial employees, and we took them biscuits that morning to welcome them. And I walked out in the lobby and I saw the backlog, so I knew it was a problem from day one. And we've had committees and subcommittees and groups of employees working on this before and after hours and trying to address it. So it's been a priority. We're trying to fix that backlog and fix that workflow in that clinic for all the patients, not just for the county patients. We're trying to fix it. Right.
Mr. Lewis?
Don, it's other Don. What's our annual cost for the clinic?
Stop whispering and hit your button.
We're running about 4,000 employees at $6 a person, so $20,000 a month, so that's
240, 250.
That's just, now that's not exact, pull you off the computer number, that's just, like I said, a rough.
And how many, what, have we done like a break-even analysis to know how many people we need to?
We're running right now about 400 encounters a month, and the number Drew said, you probably, because they're doing lab work for us as well on that, so you're looking at probably about $90 an encounter is what we're saving. So if you work it out, and we worked it out, and
Saved about we're saving about $195,000 a year.
yeah, well, that was one number. It depends almost. If you ask Drew, Drew's going to tell you we're breaking even on it, but we make 60 to 100. It just depends on what our encounters, what our usage is. But we've done the math on that early on. But Drew will tell you officially we brought break even. I think that was the first one we worked it up, was about $60,000 we were to the plus on. If you use the first 6 months data, I think is what we used this year.
Okay.
But if more people use it, the more we save.
Well, that was my point, is at what point do we look at it and go, it's either, how long do we want to break even versus, how do we increase usage?
That's something that we've tried, we've tried to drive usage to, and actually we're up. We tend to go up every year. This hurts it you know, that's what Bill's talking about, is we can go back and say they're correcting it. That's our fear, is that this will drive those numbers down to where it's not feasible. Right now, based on the numbers I saw, we're probably to the best $60,000
Year to date or annually?
annually, projected annually.
Okay.
But we have the possibility of being about 195,000.
Yeah.
If we get more involvement in it.
Okay, thank you.
Okay, ladies and gentlemen, Mr. Heineman, if you'll stand still 1 second. We have a motion and a second, and we'll go ahead and vote on this. And then if we have any other questions, or if you have any comments for us, we'll cover that after we vote on the motion we have on the floor. Don't look at me like that. Would you call roll? Please either vote to forward it to the full commission with a yes, not to with a no.
Mayor Mitchell?
Yes.
Phyllis Crisp? Yes. Gary Farmer?
Yes.
Mike Lewis?
Yes.
Ron French?
Yes.
Bill Dunlap? Holden Lell?
Yes.
And Sheriff David Merle and Tanya Birchfield are absent.
Okay. That will go on the full commission. Now, was there anything else you wanted to discuss with this committee tonight, Mr. Hyman? And I apologize for calling you Dr. Hyman.
No.
We were talking about the hospital. It just sort of fell hand in hand, and I apologize for that.
That's not an insult. That'd be kind of a compliment, but you don't want me taking care of you.
That's a valid point.
If you see me taking care of you, you're in trouble.
That's a valid point also. Any questions of Mr. Hyman? Any statements you need to make to anyone here?
I'd like to, anytime the committee would like me to come or address anything, if you'll just let me know, or let Casey know that she'll run me up here. And individually, if anybody wants to call me, have a concern or something, please don't hesitate to do that. Or if you'd like me to come to this meeting, I'll be happy to. Will's available also, handle specifics.
Will? Jody. Jody, Will. You're going to be real good friends.
We met first thing, didn't we?
Yes, we did.
Thank you very much.
Thank you.
Mr. Hyman, thank you very much.
Thank you.
And hopefully that was painless for all. However, I appreciate you coming forward and letting us know as a group. None of us were aware of the computer change or anything, and that in and of itself answers volumes. Ms. Chris?
I just wanted to say thank you to both of you, and I feel that you're a man of your words and that we will be able to call on you if needed, but hopefully that it will get straightened out, and you know, and I'll be your best advocate if it does work out, okay?
I appreciate it. We certainly want to do that. We'll try our best to do that.
Mr. Hyman, Mr. Power, thank you very much.
Thank you.
Anyone have anything else tonight? Any comments on items not on the agenda? Seeing no lights, I'll stand for motion to adjourn. We adjourned.